Are you having trouble concentrating, forgetting things, or feeling a tingling sensation in your limbs? Do you know what it could be? Well, if you want to know what it could be, I invite you to stay with me here in the video until the end. Let's go to the video. Did you know that these signs I've just mentioned of forgetfulness, lack of concentration, and tingling in the hands could be symptoms that you're deficient in vitamin B12? Well, vitamin B12 is an important component, especially for maintaining the good health of our bodies. It is part of a group called the B-complex vitamins. Vitamin B12 is also known as cobalamin or cyanocobalamin and is a micronutrient that is diluted in water. Although it's so important, our bodies don't produce it naturally, which is why you need to take it through food or supplements to supply this lack of this vitamin. As it's a micronutrient, our bodies don't need a huge amount. On average, we need 2.4 micrograms a day. That's for an adult. Vitamin B12 acts in the formation of red blood cells, which are the red blood cells in our blood that carry oxygen. But they also help maintain the nervous system. And it also helps vitamin B9, i.e. folic acid, to work properly. If you have good levels of B12, you may be able to prevent a number of diseases. Heart disease, diseases of the central nervous system, diseases of the peripheral nerves, and you will maintain your metabolic processes, i.e. the functioning of your cells with more energy. So, the big problem is when you have a B12 deficiency in your body, then you start to have problems with the red blood cells, because vitamin B12 is extremely important for the maturation process. For the red blood cell to become mature, but not just ripeness, but also completeness. And when vitamin B12 is lacking, the red blood cells start to grow too much. Then you get what's known as megaloblastic anemia, which is anemia due to vitamin B12 deficiency. Vitamin B12 acts on the nervous system. Without B12, myelin, which is the fat that covers neurons, begins to wear down. Then you start to have a process called demyelination. So you start to lose the covering that surrounds the nerves. Let's put it this way, the nerves of the body. This happens to the peripheral neurons in the arms, as well as the neurons in the head. Many people are deficient in B12 because they lose something that is produced in the stomach, called intrinsic factor.
Hey you guys, are you enjoying our content? Why I'm asking this? Because according to our channel analysis, 97% of the people who watch us are not subscribed to the channel. Do you believe this? So I sincerely ask, if you have liked our content, subscribe to our channel. Let's make this content reach everyone around the world and let's make this a healthier world, okay? So subscribe our channel and God bless you.
So people who use a lot of antacids, like omeprazole, people who take a chunk out of their stomach, these people begin to experience a deficiency in the absorption of vitamin B12. People with inflammatory bowel disease can have a B12 deficiency. The use of metformin for diabetics can also cause this. Some vegan or vegetarian diets without guidance. Diets low in animal protein. A person with a B12 deficiency may have a deficiency in the formation of neurotransmitters. You may have problems with cognition, reasoning, and mood. You may have flaws in your metabolism. You may have an increase in a substance called homocysteine in your body. When you have an increase in this, you can get thrombosis in your legs, heart, or brain. You can even have retinal problems or lose your sight because of high homocysteine levels. You can have unexplained nerve damage, unexplained pain, burning, paralysis. You can also suffer from incoordination. You no longer have motor coordination. You can have spinal cord problems that look like multiple sclerosis. To make it a little easier for you to understand, I brought you the separate symptoms of people who have a B12 deficiency. So write them down: psychological symptoms, lack of motivation, depression, burnout syndrome. A lot of people say that burnout is someone who gets stressed out at work, breaks down, and takes a leave of absence. Sometimes it's a B12 deficiency, forgetfulness, dementia, sleep disorders, personality disorders, lack of concentration, dizziness, irritability, nervousness. So if you're dizzy, you don't always have labyrinthitis. You can have a B12 deficiency, confusion, hallucinations, pallor, anemia, chronic exhaustion, tiredness, immune system failures. You start to have autoimmune diseases, or you start to have low immunity, and you start to get sick a lot. After inflammation of the stomach and intestines, gastrointestinal problems, vomiting, diarrhea, constipation, change in appetite or overeating or loss of hunger, nerve pain, spasms, vision problems, loss of balance, motor problems, faster hair loss, tingling and numbness in the limbs. Now you can have more serious physical symptoms, such as symptoms of atherosclerosis, i.e. Blood doesn't get to some places in the body. Strokes, paralysis, urinary incontinence if you can no longer hold it, peeing, infertility. Now Dayan, how do I know? How do I know that I have a B12 deficiency? I already know all this, but how do I know? Well, many tests are unreliable. So pay attention. You'll find out by measuring methylmalonic acid. Methylmalonic acid is the most sensitive marker of B12 deficiency. This test is carried out using mass spectrometry. You don't need to know this, but the test is an excellent substitute for measuring the vitamin. Another way of finding out is indirectly by measuring homocysteine. Elevated homocysteine is a sign that you may have a B12 deficiency. Anemia is usually treated within 2 months. Neurological symptoms, on the other hand, may require up to 6 months of treatment. In fact, treatment can last a lifetime. And where can we find B12 in nature? It's a vitamin found in meat, milk, and eggs. So you begin to understand that vegans and vegetarians will have problems if they don't know how to supplement. Vitamin B12 is synthesized by bacteria, which is why plant foods don't have it. So if you don't consume animal products, it's a good idea to start looking for a nutritionist who can supplement B12 for you. Talk to a professional you trust, and they'll tell you the best way, the best dosage. So, if you have any of these symptoms and notice that they're becoming more frequent, I suggest you see a professional to find out how your vitamin B12 levels are, so you can supplement. Often people are trying to solve problems with antidepressants, anticoagulants, taking medication for Alzheimer's, when in fact they often need B12. In fact, many professionals pay too much attention to the disease and prescribe medication for it. Sometimes they forget to pay enough attention to vitamins. So look how serious B12 deficiency is. Don't forget to share this video with everyone you know. Everyone. Because it's very common for people to have a B12 deficiency and treat a lot of things. Share it with people who are studying for exams, people with nerve problems, people with anemia. Share it with everyone. Now tell me how your B12 levels are. And don't forget to live this life with health, passion, and with God in your heart. Bye guys.